once this goes out, are we able to trim it once it's on Facebook, or you can only trim it if you download it?
I think you can only trim it if you download. I'm not sure.
So don't say anything you don't like.
As far as
Few spelling errors. We changed something.
Did you fix it?
Yes. Arthritis. Alright, I guess that was good enough. Now, when I'm talking, Alexa, should I stay here and point this way?
for when you're doing ultrasound?
No, when I'm pointing up here on some of the PowerPoint.
Like just during the whole thing, or when
Look,
you're doing
here's how you
ultrasound?
know that she's recording from that right there.
I know, but is it better if I go back here or stay right where I'm at and just point like this?
Do you want to come here and look at the frame so you can like have an idea of like what?
So I'll probably step into it and block it. If I go back. So I'll just go like this. Alright.
And we're live right now, so
Do we have anybody yet?
Joshua Bird.
what time is it right now?
It is 6 o'clock.
So you can just tell them a little bit about what you're going to be doing, and then that we're going to start soon.
Alright. Well, good afternoon. I'm Josh from Vance Physical Therapy and Wellness. Welcome to our clinic, virtually. So tonight we are going to take a deeper look at the shoulder. So we frequently do seminars, and we've done quite a few on the shoulder, but tonight we're going to do it a little bit differently. We're going to be taking a deeper look using a diagnostic musculoskeletal ultrasound tool. And so we're going to show some normal, and we're going to show some abnormal pathological structures, and then we're going to talk a little bit about what we can do to help those structures to help people get better, because that's what we do, help people get better. Okay, so probably the first thing we need to do is talk a little bit about musculoskeletal ultrasound. Musculoskeletal ultrasound is a diagnostic tool used, at least for what our purposes, we use it on the peripheral joints. So we cover the shoulder, elbow, hand, and wrist, along with the hip, knee, ankle, and foot. Okay, we can use it both for soft tissue as well. We use it for musculoskeletal ultrasound and neuromusculoskeletal ultrasound as well. So we use it to also evaluate the nerves in different areas of the body. But we're going to talk tonight primarily about the shoulder. So first we need to talk a little bit about ultrasound. So when we're talking about diagnostic musculoskeletal ultrasound, we need to know a couple different terms. One is specificity and one is sensitivity. Sensitivity is important because when you're looking at any diagnostic tool, the greater the sensitivity, the greater the ability to rule out a problem that you're using that tool for. Specificity looks at the ability to rule in a problem. Okay, so a higher specificity has a greater likelihood of ruling in a problem. So musculoskeletal ultrasound has a specificity and sensitivity of 85 to 90%, which is equal or better than an MRI. Now, it does not show everything that an MRI shows, in that it does not show fibrocartilage. So at the shoulder, you will see the outline of the labrum. The labrum is a fibrocartilage ring on the shoulder blade, which deepens the socket. You will see a little piece of it, but it cannot look at the entire structure, so it's not diagnostic for that. particular structure, but for tendons, muscles, ligaments, bursa, many other structures, you'll see joints, you'll see arthritis. It's a great tool, very inexpensively, that we can use in real time, as well as dynamic testing. Dynamic testing is the ability to look at some structures in real time while they're moving, which you cannot do with other diagnostic tools. So let's look at a structure right now. We're going to first look at the long head of the biceps tendon. Go to sleep. There we go. Okay, so we're looking at it in short axis. We always look at things in two axes. Short axis is essentially across the joint or across the structure. So it would be like this if that tendon's sitting right here. All right. Then we also flip it and look at long axis. So we're looking long axis or lengthwise with the structure. All right. So you can see on this, the tendon is this hyperechoic white area. You see the outline of the bone. And then you can see this hyperechoic area with sitting nicely in the groove that it's supposed to be sitting in. That's a normal tendon. It's hyperechoic, it's nice and bright. Okay, now what we're going to do is we're going to look at it long axis. And you can see the tendon's sitting right here nicely. It's fibrillar, what we call. So it kind of looks very stringy, but it's still very bright and nice and white. So that's a normal long head of the biceps tendon. Okay, so now let's look at some problems. First problem is tendinosis. So we have a tendinosis of the long head of the biceps tendon. Essentially what tendinosis is, if you think of like, it's partial fiber failure of that structure. And it's not completely torn, but it's degenerative. It's not got the same quality that, and ability that the structure would typically have. Okay, so you can see right here, this is the short axis view. Here's the bone, here's the structure, okay? It's lost that bright white, and it's actually got this heterogeneous, or kind of a little bit of a mottled appearance. There's some dark, there's a little bit of lighter, but there's no longer clearly this uniform tendon. Over here on the long axis, you can also see through here, you also have lost that nice stringy fibrillar texture that you can see down here. So what do you do with tendinosis? It's a problem that we see, and there's several things that we can do with it. First of all, we want to help stimulate healing. So there's things that we can do to stimulate healing. Cross-friction massage. It increases the blood flow to the tendon to help facilitate healing so that tendon can become improved by increasing the blood flow. Also, we would use ice and recommend the patient use ice to help with any pain as a result of that tendinosis. And then we're going to strengthen it over time so we can get as much function out of that structure as possible. And that would be a typical, maybe a bicep curl, sometimes also just elevation, but strengthening along with the ice. Therapeutic ultrasound can also help. So there's several different techniques that we would have to help facilitate the healing of that tendinosis and improve the function and decrease the pain. Okay, so here we have a partial tear and effusion. And effusion is swelling of the structure. All right, so what we see here, again, here's the short axis view, that tendon. You can kind of see this part, but that other part of the circular structure is not very visible. And over here, there's loss of that fibrillar stringy pattern, and there's darkness in here, which is the swelling, okay? And it's lost that same normal texture, okay? So, with a partial tear, what you're looking at is exercise as well as different things to help facilitate the healing. Your body heals scar tissue. That's how it heals on the outside. It heals on the inside very similarly. And so we want to do we can use cross-friction massage again to help facilitate the healing. We can also use therapeutic ultrasound. We can use ice. Could also use heat, depending on how chronic and versus how acute it is. So there's many different things. And then, of course, we want to strengthen the structure as well as the other supporting structures around it to help with the function and also minimize the pain. Because that tendon, when it's swollen, it's not going to have the same ability. The muscles aren't going to be as strong. They're going to be inhibited. And when you have any kind of a muscle inhibition, it's not going to do what it would normally do. So then you have to, after you control the swelling, you then need to strengthen that structure. All right, so now we're going to go and look at another structure. This is called the supraspinatus tendon. This is one of the most frequently injured structures in the shoulder. And we're going to start in the long axis view. Okay, so you can see right here we have the tendon, and this is the bone again, and all this is tendon, and the fibers of the tendon are nicely going into that bone. It's got very similar texture, it's bright, and it looks good. Normal shoulder, and then we can flip it over, and we'll look at what we call the tire on the rim view, because you will see it looks much like a tire on a rim. All right, so here again, this is now a short axis view, and you can see this nice white area. It's normal. You can also see the cartilage here. That's the little darker line under it, just above the bone. So that's a normal tendon. So looking at a strain. So here we have a strain of the supraspinatus tendon, and you will notice right here, this doesn't look too bad, but right up here we have this black area, or hypoechoic area. That's suggestive of essentially a partial tear. So strains are graded in different grades depending on the severity. Everything from a mild strain, damage to the cellular level, to partial tears, to a complete disruption of the tendon. Obviously that would be a significant strain, but that's a strain. So what do? We want to help facilitate healing. We're going to do some exercise to help decrease the swelling. We're going to do some soft tissue work to decrease the swelling potentially. You're going to use cross-friction massage again. That's great because it really causes a lot of increased blood flow into the tendon, and we know exactly where the tissue injury is. So we want to help facilitate that healing, and then we're going to strengthen that. So there's a lot of things, sometimes some stretching as well as of the supporting muscles, because they tend to get a little bit tight because of just kind of guarding and protecting when we have pain. Now, so this is actually a before and after. So you can see over here, that's the same picture. We can see that hypoechoic area there where we have a partial tear strain of the tendon. And then over here, it looks a little different because muscles here, the sound heads just turn in the opposite direction. But after 8 weeks of physical therapy treatment, you can now see that that is significantly better. We no longer have that same area. It's doing very nicely. All right. Okay, and then of course we can have a full thickness complete tear. All right, we see that sometimes. We have on the long axis here, normally we see this nice tendon filling in here. We also have some changes right here on the bone, but there is no tendon attaching there. And in the tire on the rim view, short axis, there's nothing there. All right, so that's suggestive of the full thickness, complete tear. And when we see that, we then send them back to their doctors so they can go see a surgeon. Okay, because that's not going to be something that we're going to be able to help improve without surgery. Okay, so another problem that we frequently see is bursitis. All right, so this is what bursitis looks like on a diagnostic ultrasound. What is bursitis? Let's talk about that. Bursitis is an inflamed bursa. Bursa are fluid-filled sacs which help decrease the friction between tendons and bones, typically. All right, and there's the subacromial bursa, very frequently a site of inflammation and pain, along with impingement and other issues, which you'll see right here, but it gets swollen, all right? And so a normal bursa, the bursa actually is lying right over there between the tendon, okay? You don't see it because it's normal. However, with pathology or problems, here's the bursa. You can begin to see it because it's now filled. So you get this hypoechoic area, all right, and then flipping over onto the short axis view, you can see the same part of the bursa right there, all right? So we now have a bursitis issue. So what are we going to do? We're going to help with the ice. We're going to modify activities so we're no longer irritating that as we reach up. That can cause compression and pain. We're going to do some strengthening and we're going to help calm it down. All right, that's a peek. All right, so now we're going to move on to another tendon. This is called your infraspinatus tendon. Freeze. Another one of your rotator cuff tendons. Alright, this is a long axis view. Tendons on your shoulder blade coming around, then attaching right over here. So you can see, here we are, tendon coming over. It's nice, bright and white. It looks pretty. Alright, so then we are going to look right up here, okay? So here's the long axis view, and you can see the tendon, but we have some hypoechoic area here. Again, we have some tendinosis and or partial tearing. And there's a fine line between the two, because tendinosis, there's some fiber disruption. And so we have that hypoechoic area, that darkness. It's no longer got that nice bright white attachment up here on the bone. In short axis, you can also see that through here too. So we've lost some of that. Treatment, very similar. We're going to work on facilitating increased blood flow. We're going to decrease the pain. We're going to decrease the swelling and the inflammation. And then we're going to strengthen. That muscle can still get stronger, but we got to do it in a way that's pain-free. By the way, infraspinatus is responsible for externally rotating the arm or pushing your arm out that way. So anytime you're doing your hair, you're using it. Really important muscle and structure to have working very good to do hair and other things when you're reaching up overhead, as well as out to the side. Okay, so now what we'll do is we're going to look at the back of the shoulder, a view of the back of the shoulder. And you can see a couple structures here. Let's go a little deeper. All right, so here we have the head of the humerus. Here's your infraspinatus tendon. This is the outline of the socket, if you will, and then the labrum's right in here. Okay, the labrum is that fibrocartilage ring again that we talked about, not diagnostic, but in this view we do actually see a bit of it. If there's a problem, you can kind of get a sense of it, but then they need further testing. So, now, in this view, you can see how nice that bone is, the head of the bone here. Now over here, in the same view, on this particular individual, well, here's the bone. All right, we have arthritic change. That bone has lost its normal appearance. It's got a lot of changes on the cortical changes, a lot of change. So it's suggestive of arthritic changes. Over here on this other view that we did just a minute ago, looking at the supraspinatus tendon, you can also see changes in the bone structure. Okay, suggestive of arthritis. Okay, so what do we do with arthritis? Arthritic changes, partly it depends on the severity. Sometimes people have so much arthritis and it's so bad, the only thing they can do is a joint replacement. Okay, for mild to moderate arthritis, there's things that we can do. There's conservative treatment. We can do exercises. First thing that typically happens is the joint gets stiff, okay? And so it no longer moves with the same quality that it would normally have. And so as you're reaching up and moving, it does not roll and glide like it normally would. So what we're going to do is we're going to do some joint mobilization to help create some better movement of the bone so that when you're reaching and moving, we have better motion. Then we're also going to work on pain control. We're going to be using ice or heat, whatever's indicated based on how long we've had it, if it's a flare-up, a few different issues. And then we're going to work on strengthening, because the stronger the muscles are around the joint, the research shows the less pain we have. So we also want to have better function. So the better the muscles are working not only on the rotator cuff, which is responsible for rotating the glenohumeral joint or the ball in the socket, but also the shoulder blade muscles, because they help position the shoulder, because the ball or the socket is attached to the shoulder blade. So if we don't have good positioning of the shoulder blade, that's going to then mess up how well we can rotate and move. Okay, so we'll do some strengthening to help with arthritis. And then a lot of education, modification of things sometimes. There's some activities that may be more prone to hurting, so we want to help you understand what those would be in your particular situation. So that's a little bit about arthritis and what we can do. Okay, so now what we're going to do is we're going to look at a joint called your AC joint. Stands for the acromioclavicular joint. It's where your collarbone attaches to your shoulder blade, if you will. All right. I'm going to go a little shallower here. All right. All right. So there we have it. All right. Okay, so over here we have the collarbone, over here we have what's called the acromion, and the joint is right here, and we can also see right here, there is supporting structures. You have the ligamentous complex and the joint capsule overriding it. There are times when you see problems, which I think we will see in just a second. But so let's look at this. Okay, so we have, here's the AC joint, okay? And you can see that there's a large area under here that has that hypoechoic dark area, which is suggestive of a fusion or swelling, okay? We call it a joint fusion, but it's essentially swelling of that joint. And then that then pushes up on the joint capsule and the ligaments, causing suspension to them. And then over here we have a different structure, which is the coracoacromial ligament. It attaches in the front, kind of like right here, from the bone here to here, and you can see that nice stringy fibrous area across there. This is normal, by the way. But what a sprain is it is similar to a strain, but it's only to a ligament. A ligament connects bone to bone. Okay, so we have bone on both sides. We have bone on both sides. That's this area and this area right here. All right, so the part of the ligament, the role of the ligament is to help provide stability to the joint. All right, and when you damage it, you can then lose stability depending on the severity, and they can grade it 1, 2, 3, etc. based on how much damage you have to the structure. Now, when you have a small or low-grade sprain, you have disruption of the fibers, perhaps more at the cellular level. So you may not see it, but it's painful. With a higher grade sprain, then you can see more significant damage. You can see sometimes where the joint may be moving more because it no longer has that same stability, so it becomes hypermobile. That can then cause pain. Well, what do we do with a strain? Same thing. First, we want to help decrease the pain, control pain and swelling. Your body's first response to any kind of tissue trauma is inflammation. The inflammatory stage is the first stage of tissue healing. We don't want to stay there. We want to move through the other stages as well. So we'll ice it to help decrease that. We'll do some exercise to help minimize loss of motion. We want to maintain strength, but yet we don't want to do it in a way that's going to do a lot of stress to that ligament that's been injured. If we do that, then we're just kind of pounding away on that ligament, and it's going to take a lot longer to heal. It's just going to keep re-irritating it. So you got to keep it in a way that doesn't hurt when you're exercising, and we allow tissue healing to occur. Basic tissue healing in physiology takes 6 weeks. Things can hurt longer, things can hurt less time, but basic tissue healing takes 6 weeks for that structure to begin to be stable from at the cellular level. Now, there's things that can prolong it, not doing the right things, where you're pounding away on it and overstressing it, diabetes, other things, for instance, that can cause that to take longer. Okay, so what we're going to do now is we're going to look at so I'm going to show a couple dynamic tests now. We're going to first go back to the long head of the biceps tendon, because sometimes that can move out of that nice, what we call the bicipital groove, that nice groove that it sits in. So let's look at that again. Okay, so you can see that bright structure there. Now what we're going to do is we're going to move just a little bit, nice and slowly, and you're going to see that that structure stays in that groove, nice and easily. Okay, there are times when I've had a couple patients recently, where that long head of the biceps tendon is not where it's supposed to be. And so this is a dynamic test for making sure that there's no subluxation of that tendon out of the bicipital groove, okay, which would then obviously cause pain and problems. So another test that we do is called an impingement test. It's also a dynamic test, and it looks for what's called impingement. So impingement is basically compression under the roof of the shoulder. If you're looking at the roof of the shoulder, it's kind of like so. You have the ball in the socket, and things are supposed to move nice and smoothly under that. Well, with impingement, what happens is those structures get slammed up against the roof of that shoulder, or the roof of the shoulder. And it just kind of bunches up, and it actually looks on ultrasound like it gets sheared off a cliff or something. All right, but it's going to cause pain, and that's, by the way, there's that bursa that we talked about, that subacromial bursa. It's sitting right there. That'll get inflamed, and then you have rotator cuff tendons under there too. And so that can damage those rotator cuff tendons over time too, causing pain, tearing possibly, and eventually the need for surgery if it's significant enough. All right, so first. So we gotta get our little structure here. Okay. So I'm going to freeze that right there so we can explain it. All right. So right here is basically the roof of the shoulder here that we were talking about. Here's the rotator cuff, here's the humeral head. So what we're going to do is we're going to move, and we're going to see what happens to this as we're moving, whether or not we get some compression, or it bunches up here, or if it slides nice and smoothly under there. All right, here we go. And you can see that it just moves nice and smoothly, kind of under that area. We'll do it again. It's not bunching up at all, but this is another dynamic test that we can evaluate for whether or not they have impingement of the rotator cuff, which is problematic and painful. Alright, with the dynamic testing, we can totally evaluate that and know, and if they are, then we can modify our treatment based on what we see with that. Alright, so again, here we go. Here's the roof of the shoulder, here's the tendon, head of the humerus, and we're going to watch that video, see what happens there. As it moves, so you can see it again gliding under there. This is a normal shoulder. As it moves back and forth. Alright. So, that's a little bit about diagnostic ultrasound. It's a little bit about different problems that we see. There's a lot of other things that we might see. We might see a frozen shoulder, adhesive capsulitis. What that is that's basically, that's a very painful condition, and the joint itself gets scarred over, it gets painful, and that joint mobility gets restricted, it gets super tight. Alright, that then causes pain, loss of motion, and it's terribly painful. So what we have to do, we have to restore that normal ability for that joint to move and glide. We have to get the strength. We have to help with the pain control. All right. There's many other things that we have ability to help with, but those are just some of the things that we see. And I wanted you to specifically see what it would look like on diagnostic ultrasound, because we can help not only just help you get better, but we can also quickly identify what the problem is, and then get to the root of the cause, so that you're not wasting your time. And if it's more significant, we can send you where you need to go. So at this point, if you have any questions, we would love to hear them and try to answer any questions if you have. I hope you've enjoyed tonight and that it's been helpful for you. We'll be here for a little bit. If you have a problem and you want some help with it, or you want to just talk to someone, we're free to do a free consultation. All you need to do is let us know. You can email us. Josh@vancept.com would work, or you can go onto our website, vancept.com. You can also Facebook us. You know what that is if you're joining us right now. Just get in community, and you can also call us at 592-7117. More than willing to talk to you and take a look at things and see if there's something that we can do to help you so that you can get on with your life and live optimally.
There's no questions right now. That was really fast. Sped through that.
Yeah.
I wanted to get it over with.
Well, it's just going.
Yeah.
Yeah. I thought that would probably take a little bit longer when it came to discussing it, but
Are we still recording?
Do you want me to stop?
Probably. If there's no questions.